So welcome everyone to our Wednesday webinar, Tailoring Therapy for Transgender and Gender Diverse Clients, Effective Strategies for Better Outcomes with Chloe Corcoran and Angela Krumm. And I'm going to have Angela forward the slides. We're going to start by, I think we're in for really a very special an amazing webinar today. I'm super excited about it. I'm going to introduce you to today's presenters and say a few things, and then I will pass the presentation on to Angela and Chloe. Um, so Angela Krumm is a licensed counseling psychologist and the clinical director at the Feeling Good Institute. Dr. Krumm has almost 20 years of experience conducting cognitive behavioral therapy with a special focus on anxiety disorders and social skills. She's served as a professional ally working to support members of the LGBTQ community. She was the co-founder of a long-running peer mentor program for LGBTQ students at San Jose State University. She's conducted research and published a paper on discrimination based on sexual identity, and she's provided numerous therapist trainings on how to provide affirming care to members of the LGBTQ community. And Angela uses pronouns she, her. And Chloe Corcoran is Director of Alumni Relations at Palo Alto University and has worked in higher education for over 10 years in fundraising and engagement. A former collegiate football player for 4 years, she was cast in Being Trans, the first audio trans-related reality show, which has had articles about it appear in the New York Times. Chloe's appeared on a billboard in Times Square, along with being honored by the LA Dodgers for her activism. Chloe earned her master's degree and is currently studying part-time toward a PhD in higher education leadership, where her work focuses on equity and inclusion. And Chloe uses pronouns she, her. I'm super excited to have this presentation by Angela and Chloe. I'm just going to take a quick moment to share a few things with you about who we are at Feeling Good Institute, give you a little snapshot, and share with you about our mission. So our mission is to make a difference in people's lives through elevating the practice of therapy. And our story started with the goal of really trying to make therapy better and help people who are going through tough times. And we achieve this by training and certifying therapists in effective therapy techniques. We have a comprehensive 5-level Team CBT certification system that provides a path to mastery in Team CBT. We're really proud of what we do, especially all our therapists who practice Team CBT. We have treatment available in over 35 states across the US and Canada, and we offer therapy both online and in person. We have an intensive one-on-one therapy program, which speeds up recovery with extended and more frequent sessions. And we also have a program to offer lower fee options supervised by advanced clinicians so that people have more access to high quality care. And just to let you know how you're going to get your CE credit today. So you do need to stay for the whole presentation. And at the end, about 5 minutes before the hour, I will drop the link to fill out the CE survey in the chat box. So you just need to fill out that link on time today, just at the end of the webinar, and then you'll receive your certificate of completion via email within 1 week. So again, that will not come immediately, but we will email you that certificate of completion within a week of today's webinar. And now I'm going to turn it over to Angela.
Gotta unmute. It's first time on Zoom. Apologies. Okay, what's our plan for today? So thank you for those nice introductions, Jill. So we're gonna talk a little bit first about some mental health topics, including mental health disparities and reasons to seek treatment. Then you're going to get the real reason you're here today, which is to hear more from Chloe. It's why I came back again today, because I love hearing Chloe talk about her story and share her wisdom. Finally, we're going to spend a chunk of our time, an important chunk of the time, talking about how we can work as mental health professionals or medical professionals, for those of you in the group who fall into that group, to create more affirming experiences. And within that topic, we'll talk about what we can do as therapists or providers, whether lived experience is important to have as a provider, as well as talk just briefly about the World Professional Association for Transgender Health, WPATH, standards of care. So if those are new to you, we'll talk about what that means and some of the complexities that come along with that. And we will do everything within our power to save some time for Q&A, which, as Jill mentioned, you'll chat your questions to Jill Chloe and I are way too distractible to manage those in the middle of a presentation. So please, those will go to Jill. She'll be like the facilitator at the end. Okay, so if you're chatting to Chloe or I, prepare to be ignored lovingly during the presentation. So let's talk a little bit background. Why are we offering this presentation? Well, the truth is that discrimination and marginalization of folks who identify as gender diverse or transgender continues to exist, right? And so folks are at greater risk for struggles because of these added inequities in their life. The journey of exploring gender and considering or acting on transition is, not without hardship. It's a complex process for many people. And so we do become aware that even within medical and mental health services, that negative experiences are unfortunately still prolific, right? Very common, and can deter folks from seeking treatment for whatever their mental health concerns are, and deter them from seeking support around gender identity. Right. So there's also ample research evidence that when providers have received additional education and knowledge to better understand gender identity or transgender experiences, that they are eventually rated as more affirming in their care. So it's good you're here, and it's good we're all here and continuing to learn. At Feeling Good Institute, we continue to try to prioritize this journey of making our approach to treatment, Team CBT, more affirming whenever possible and as inclusive as possible. And it is true that CBT can be delivered, like any modality, can be delivered in a way that is hurtful and harmful to people, or a way that's really affirming and helpful and positive. And so we hope today to help folks see some of those paths towards affirming approaches. How will we do that? Well, we have just two simple learning objectives because it's a short time together. We hope that you can leave naming at least 3 things you could do, even starting today, to make therapy more affirming. And we hope that you can better describe a therapist's role in working with gender diverse clients and trans clients. Today we really do hope it's an opportunity to grow and learn together. I come to you very humbly, realizing that I'm not the expert. I don't have lived experience, and I will even today potentially make mistakes in my phrasing or how I approach things. And so there's this awesome opportunity at the end to fill out this survey and just give us your honest, raw feedback, right? I think Chloe's open to that feedback as well. And we want to hear from you because there are likely people in the audience who have more knowledge than I do, who have different lived experiences, and you'll very quickly see what maybe we missed or what you feel we misrepresented. And we want to hear from you in those cases, okay? Okay, so let's start with what is my favorite slide of all, which is, why do folks who identify as trans or gender diverse seek treatment? And I joke that my favorite slide because the simple first bullet point is the most important thing you can take away from today. Any reason? What does that mean? Does that seem too obvious? Let's think about it a little bit together. Well, the reality is that folks come to treatment for all kinds of reasons, and sometimes it has nothing to do with their gender identity or any of their identity variables. And it can not only be inaccurate, but even harmful to assume that people are there for that reason. And this was brought to life with me with a trans man I worked with years ago who came into therapy the first session. And the first thing he said upon sitting down in the chair is he said, "I'm a trans man. Let's just get that out of the way. That's part of who I am. I've worked through that. I'm good. Can we talk about my relationship with my dad?" And I just chuckled and felt this tremendous appreciation for what he must have been through in so many therapy experiences to need to lead that way, right? To help me understand that, like, yes, this is part of who he is. And I might be curious about that as his therapist and want to know more about it. But he's not here today to tell me his story or to talk about that part of his identity. At least today, what he needs is help with this other problem. So folks, of course, come in with all kinds of problems, just like cisgendered folks do, and that's what we want to treat. Now, of course, they also can come in for gender-related reasons, and I'll talk about a couple of these and then pass to Chloe to talk more about it. So exploring gender. Of course, people may be at any stage of understanding their gender identity. They may be coming to counseling to look at their own view of gender. They might be exploring where their views of gender came from, whether it was their culture, their family, and wanting to better understand those things. What does it mean to us? How do people react to gender? They may also be coming in because of experiences of discrimination or trauma based on their gender identity, right? And the important point to remember in those moments is that their gender identity is not the identified problem that's bringing them to therapy, but people's reactions to them, right? The discrimination, the societal reaction to their gender identity that leads them into your therapy room. And of course, in those opportunities as therapists, we have the um, gift of supporting them as we would other folks who've been treated unfairly or had trauma or discrimination, and work with them from that lens. Chloe, why don't you jump in here and talk about this next part?
Absolutely. Thank you. And thank you all for being here today. I think it says really good things about you. I'm going to assume it's because you care and you want to get better, especially in this area. So I'm very thankful that you're here. For me, my therapist was instrumental in my ability to get to a place where honestly I could survive. I truly believe that the therapist I had during my transition helped to save my life. Now, as we get going here, I'm going to give you a little bit of background and a little color about my story, but I do want to start this out by saying it is one story. There are some things that will be similar across trans experiences. Some parts of mine are probably fairly unique. And I hope that you'll be able to take those in and say, okay, well, this makes sense for this person I can be aware of, but it may be different with some of the clients that you work with. I also want to make sure that I cover a quick terminology lesson. Cisgender and transgender, you may hear in some circles that cisgender is a slur. I promise you it is not. Cis meaning same, meaning your gender identity correlates with your sex assigned at birth. Trans meaning different. Your gender identity is different than what your sex was assigned at birth. So I was assigned male at birth, and I learned early on in my life that expressions of femininity were not going to go over well in my traditionally Irish Catholic household. So I buried all of that away and I got very into sports. I accomplished what every young girl wants to do. I became homecoming king and captain of the high school football team before going on to play college football. A little unique in some regards there, but it was a way for me to make friends. It was a way for me to fit in. It was something that I was good at because all I had to do was work really hard at it and I could at least be okay. So, high school, sophomore year, I was homecoming king, was riding high, playing varsity football. And then my first depression was really big and it hit my junior year of high school. And I really think that's when being trans really started to come back to the forefront of my mind. And I was just deeply unhappy. But my grades went from literal 4.0 straight A's to A minus, A, B plus. I was doing what I call being loud enough to be quiet. So don't take that because that is going to be the title of my first book. I was making enough noise that people would notice me and think that I was okay, but they wouldn't ask questions. I was struggling in certain ways, but not in ways that were very noticeable. You could chalk up the grades to junior year being more difficult. My athletic performance, however, slipped, and that was noticed fairly quickly. And I got a lot of advice and cajoling and anger about how I need to improve and many things along those areas. But I still played well enough. I got recruited by a dozen universities, and I ended up attending the University of Rochester. And I played football all 4 years while I was there. I lived in a dorm with a lot of other athletes, mostly football players. Got up to shenanigans like tennis ball wars. It almost cost my friend Ike his eye. He said all I could see was yellow fuzz. We had some stereotypically considered male times in there. But I was also friends with a lot of girls on the soccer team, the field hockey team, and some others. And at one point, we had a talk, and they said, "Look, we don't know what's going on with you. We don't know what's wrong, but something is wrong, and you absolutely need to see a therapist." And they weren't wrong. I was still really struggling and wasn't being as quiet as I had hoped to be about it. So I started going to therapy, and at the time, not many people knew about gender diversity or being trans. So I got shuffled around a lot and shuffled around very quickly in that regard. It didn't take many sessions to be moved on. So finally, they put me with the director of the counseling center at my university, and she did a great job, to be honest with you. And we had a point, I had never said that I was trans. I said, I'm worried that I might be trans. I'm worried because I kind of feel this way. And we eventually got to a point where we came to an agreement that I am trans. And my first reaction was, okay, cool. How do I unknow this? Like, can we put that back? Because now it's real and now I have to deal with it. And I am absolutely not ready for that. So I went on, I graduated, I got into law school. I decided not to go because my depression was too much. I knew I couldn't show up in the ways that I needed in order to be successful in such a demanding program and field. So I got a job at a law firm, worked as a paralegal, and then I started seeking the geographic cure. I moved a few places down in the Baltimore, DC area, shipped up to Boston for a while, where I worked a full-time job and a couple part-time jobs, one as a bouncer in Chestnut Hill. If anybody knows Boston well, it was quite the experience. The one rule I had with the people was, look, I know you come in every weekend and you get in a fight, just have another job. Don't hit me in the face. And to their credit, they never did. So I got through that, moved back to Rochester, and started a career in fundraising, and was still trying to get by. I kind of settled into my life of trying to outgrow being trans. Doesn't work. I don't know anybody who that's worked for. And eventually I hit a point where I was so depressed. I wasn't going to make it. And I say I had to transition, and it was a little bit different than that. You know, I will be honest with this group because I feel like it's important. The reason I transitioned had something to do with my upbringing in the church, in that I was terrified to, I'll call it, not be here anymore because of what I thought would happen after that. And I said, you know, I don't want to do anything without knowing I've tried every possible thing I could to get better. And the only thing I hadn't tried was transitioning. So I thought, well, I'll give this a month, maybe two, possibly three, and then I can say I tried it. I gave it my full effort, and then I can make decisions from there. In my mind, I had already made a decision. So I went through transition, came out. My coming out day at work was the day the federal election results were announced in 2016. I've always had a knack for timing. So that was an interesting moment in my life and that of many other folks. And people even now will say, oh, when you transitioned, your life got better, right? And I have to be honest, no. My life got objectively worse in so many ways, but I wanted to be here. I hit month 2 and I was like, oh, all right, we'll see. We'll give another month. Hit month 3. I was like, oh, I guess we can give it another 3. And all of a sudden, it'll be 8 years this November, and I'm still here, and I'm very happy to be. And I want to touch on some things that Angela mentioned before about some of the issues not really being about gender identity, but being about what happens to us in those spaces. And this is where my counselor at the time became incredibly important to me. Speaking of workplace discrimination, I had a supervisor at the time use a slur for the LGBTQ plus community against me. And the response was to functionally demote me and then bounce me around until they put me with a supervisor who is well known to not be a fan of mine. And my counselor throughout all this, I was the first trans person she had ever seen. I started seeing her probably a year and a half before I actually publicly transitioned, and she helped me through that. And she was a cisgender heterosexual woman, and I was her first trans client. She had not met. I don't know if she had met other trans people, but I was her first client, and it was really important to me that I didn't know that by her reaction. I didn't know that at the time. She said okay, and she went out and she didn't try to refer me away immediately. She went out and she did the work. She learned about community resources. She read the literature. She talked to other professionals, and she did that within her own community, as opposed to having me try to process her reaction to me with her. And that was incredibly important for me because it felt like, okay, she's still here. She didn't leave me. I had a little abandonment thing going on at the time. And she just stuck. Oh my gosh, even think about it now. I send her an email once a year, just let her know I'm doing well. So she stuck with me, and some of the things that she did were so important. And I hit a point where I was like, I got this. I got this figured out. So I had my first moment going out, and by going out, I mean presenting in public as myself. I went down to New York City, and I was so prepared for this to be awesome in my own head, and it was anything but. It was a disaster. I went with the wrong person. I stayed at the wrong place. I went to a bar slash club where 6 men surrounded me to assault me. And then I was saved by a girl whom I had never seen in my life. She came over and she grabbed my arm and she said, "Oh, come on, our friends are over here," and brought me to another space where the bouncer found me and then kicked me out. And the reason I'm illustrating this story is because these are some of the realities of what we face. This isn't an anomaly, unfortunately. So my therapist at the time let me process that for a session and a half. So about an hour and a half, I was able to sit with my feelings. I was able to be upset. And then she started moving me towards a different process. And we started a lesson that I've taken with me through my entire life is, Chloe, did you set yourself up for success in this instance? And we went over my decision-making process at the time. And why did I choose this place to stay? Why did I choose this person to go with? Why did I choose these outings? And they were all based on what I wanted the reality to be, as opposed to what I kind of knew the reality was, especially, for my first time out. And we said, and that's something I do to this day. When I look at a situation is, am I setting myself up for success? So I moved on. I left. I lived in Sacramento for a bit before moving to Los Angeles. And my life is quite different now. I live in Hollywood, and I asked myself during the pandemic, do I really live in Hollywood if I've never auditioned for anything? So I auditioned for an audio reality show, and somehow I was cast. They followed me and 3 other trans people around. For me, it was 5 months, 15 to 20 hours a week. It was pretty intense. The last person I saw before going into one of my surgeries was my producer, who was awesome. Now, I didn't find out until after the recording was done that my producers were the original producers for the Kardashians, and I hadn't heard what they had done with the editing yet. So my thought process was, oh no, what have I gotten into? But I think they really did a really great job with our stories. It's me, there's another trans woman, and a trans man and a non-binary person, all from different areas and walks of life. Jeffrey was from Texas, Cy was from Louisiana, Mariana, I believe, was from Venezuela. So a lot of different experiences rolled into that. We were all very different. It's called Being Trans. You can check it out on Spotify if you'd like. But that really opened me up to some more things. I started, thinking about maybe I can act. So I started acting. What I really ended up getting into very strongly was public speaking. And one of the reasons was because when I came out, I wrote an article to an author whose name is Jennifer Finney Boylan. And one of the books she wrote is called She's Not There. And when I read that book, I thought, okay, it's okay for other people to be trans. Okay, I get it as a concept. Other people, not me, but other people can be trans. And I sent her an email on my coming out day and let her know what her book meant to me, because it started me on a path towards accepting myself. And she wrote me back within an hour, which was quite unexpected. And she said a lot of nice things. And one of the things she said to me was, Chloe, part of your job now is to do for others whatever it is you feel that I've done for you. And I really think that as therapists and counselors, that's something that you really have an opportunity. And I'm pretty sure you probably entered the profession because you wanted to give back, because you want to help other people. Maybe somebody helped you along the way. And that's why I'm really glad to be able to come here and share parts of my story with you today. And I'm going to leave you with one more small piece that kind of illustrates the importance of visibility and working through and honestly staying around, just sticking around. Is the first public talk I ever gave was outside the Federal Reserve building in my hometown of Rochester, New York. And it was very hot, which is relevant later. And I was very nervous, and everything about me was shaking except for my voice. I hadn't really done this before. I got down from, where I was speaking in the bullhorn, and I was quite relieved to be done. And this woman comes up to me and she says, Chloe, I want to thank you. You're such an inspiration to me and my family. And obviously you love to hear that because, I feel like I made an impact. And part of me is also like, well, I didn't ask, of course, but who's your family? I don't see anybody else here. All of a sudden, this little girl, she's probably 7 or 8 years old. She's got these blonde curls. She comes running up to me with this huge smile on her face. And she looks at me and she just goes, I'm transgender too. And the reason I'm glad it was hot was because the sweat could blend in with the tears that almost immediately came when I turned away. And that's when I knew that I was the representation and some light in her life that I didn't necessarily have when I was growing up. So I just want to impart on you that even if you don't know if that session made a difference, it probably did. And I appreciate all the work you do. And thank you for letting me share part of my story with you today.
Thank you, Chloe. So happy to have you sharing. It feels like you're doing exactly what the mentor suggested of bringing forward what's been done when you're sharing with us and helping us think about how we can be more affirming. Thank you. So let's just pause and have folks think about that for a moment. What have you heard in Chloe's story that you can take from today to challenge yourself to create more affirming experiences? There were some hints of things that her therapist did for her that other folks in her life did for her. And I imagine your brain is already starting to see some of that. We're going to talk about some specifics in a moment, but I definitely heard Chloe talk about this therapist who was willing to learn and do their own work and make space for feelings, right? And before moving towards helping her look for what she could how she could set herself up for success. So we're going to spend quite a bit of time on this slide. I'll do the first handful. Chloe will talk to you about the final bullet points here. So again, this is our list where we want you to be looking today for some of these that you could take with you and maybe implement right away, right? So the first one we'll talk about is this idea of not rushing to do things, but to simply remind yourself to sit with the gravity of the sharing that has been generously given to you by the client sitting in front of you. In some cases, you may be the first person to hear someone's questions around their identity or their realizations around their identity, right? And you might literally be the first person they've spoken this to. And wow, what a gift, what an honor. And we've heard from plenty of folks within the gender diverse community that the rushing past that is really painful. And I think actually the more you've worked within the community, the easier it is to make that mistake because you're not maybe, sitting with the gravity or you're kind of see this as part of a counseling process and you might move too quickly. So we just want to encourage you to slow down, honor this amazing sharing that someone has taken this risk to share with you. Not rush to do. Doing can come later. And then, of course, we want to really focus on this idea of affirming the real experiences of discrimination, trauma, or othering that have occurred for folks. I think that sometimes as humans, when we hear about other people's pains, it's so much to process that we kind of want it to be less than what's being described to us, right? We kind of hope it's not as bad as they're describing because it hurts so much to sit with it and to feel that, right? And so we can subtly or directly kind of negate or minimize folks' experience through our reactions or our rushing past them. And so we just want to acknowledge how very real experiences are for the gender diverse and trans community and make sure that we've slowed down to really affirm that reality and not engage in ways that kind of minimize the impact. And the third point, we'll talk about this one in a little bit more depth. So cognitive therapy specifically, there's a little bit of a danger zone and when we think about what we call distorted thoughts. So for those of you who aren't as familiar with CBT, I know we have a lot of experts here in this group who are, but one of the hallmarks of the cognitive part of CBT is this idea that our feelings are largely created by our thoughts, right? So how we talk to ourselves, our self-talk creates our feelings. and that a lot of our negative feelings are fed by errors in our thinking or distortions, right? That's kind of a hallmark of cognitive therapy. I want you to pause and think with me for a minute about how that could be harmful or painful to clients if done sloppily, right? It also can create huge healing for folks when they realize that they've been talking to themselves in unhelpful, untruthful ways, and they remedy those errors. There can be tremendous relief and joy and healing that happens. But as anything that's powerful, it can be used to help or to harm. So in this case, the most often time we see where distorted thoughts are used to create harm is when we take people's examples of harmful experiences and allowed them to assume that we're interpreting it as just an error in their thinking. I'm going to bring this to life with a case example because this might feel a little confusing or complex. So I'll use the name Danny. Danny is a trans woman who I worked with when she was enrolled in a college nursing program. And Danny was someone who did not pass by standard societal views and actually was not interested in some binary version of passing to begin with. And the folks around her often reacted to her with confusion around her gender, often asking questions that felt inappropriate, sometimes even hostile, and kind of expressing their own discomfort with the fact that she wasn't buying into a binary that maybe others feel more comfortable with. And in her nursing program, what was playing out for her is that she was really just rocking it academically in the coursework, right? Doing really well. But she was at the phase of her training where she needed to be in and out of hospitals and like her practicum type settings, where she's actually doing patient care and receiving feedback on her skills. And patients were reacting to her with some regularity in negative, confused ways, right? And as she encountered more experiences of negative reaction, her anxiety went up. And you can imagine how this becomes this snowball effect where she has negative reactions from people. She gets more anxious. Her bedside manner skills drop. She gets more anxious. She gets more negative reactions, right? And it's becoming the snowball to the point that she was starting to get really negative feedback from the nurses who were filling out the evaluations and such. And she came to me in this conundrum. And in cognitive therapy, we very quickly, after empathy and support, we moved towards daily mood logs, or some cognitive therapists call them thought records. And so some of the thoughts she was having were things like, these patients are reacting poorly to me. I'll never be able to be a nurse. I won't get the mentorship I need. And the program is not supporting me. Right. So a common mistake in cognitive therapy, if we're moving too quickly and we're too focused on this idea of thoughts that create pain must be distorted, and is that we might ask the person to quickly identify the distortions here and then imply that the thoughts are not accurate. So let's look at that first thought. The patients are reacting poorly to me, right? If we're quickly asking her to look for the distortions, she might hear from us a negating of the reality of this situation. So luckily in Team CBT, we have some skills that help us avoid that error. A couple that are, front of mind for me are what we call positive reframing, and then also something called radical acceptance. So in positive reframing, we have this really important step where we let a client slow down and look at the wisdom, the truth, the good parts of a thought that may be on the thought record, right? And see how this thought might be serving her in some way or even reflect her values. We also, this concept of radical acceptance encourages clients to look for what parts of the thought are really true and that we have to accept, right? And so by the combo of these two skills, it allowed Danny to find the truth in the fact that people were reacting negatively to her, and also, having done that, figure out which parts may also have been errors in her thinking. So again, it seemed like Danny was being discriminated against in her program. But as we parsed out the difference in the thoughts, she also was able to begin this journey where she could talk back to the parts that did have errors, like, I'll never be a nurse, which actually turned out not to be true. She actually sent me an update, found me on LinkedIn just recently and told me she's working at a nurse in an LGBT clinic and really loving it. The parts that were true, we were able to shift towards things like planning for how to set ourselves up for success. Also something Chloe had talked about, practicing how to engage with patients who are reacting negatively, for her self-advocating with her mentors, finding allies within the nursing program, and even finding a team of folks to work for like systematic change for some problems that were present in that program that were leading to her not get support. So we want to move slowly with distortions, right? That's a lot to say about that. And remember that, again, something as powerful as identifying distortions that can really be used for healing, if misapplied or rushed through too quickly, could also be used to dismiss and cause pain. Okay. I'll talk briefly about gender neutral language, and then you'll get to hear from Chloe again. So um, paying attention to gender neutral language, I think, is really important in creating affirming experiences. Clients who are gender diverse or trans or even questioning gender will look at your written materials to find out if you are likely to be affirming or not. So if your website, your directory profiles, your consent forms imply things like the gender binary or use other commonly gendered terms like fireman, right? I doubt you're talking about firemen in your intake paperwork, but the point is, if you're using these gendered languages, it's subtle hints that they're going to pick up on, because folks have had so many negative experiences. They're looking for any indication of affirmation. So your choice to use gender neutral language is respectful and sends a message that you are affirming and open. So I'd encourage you to look at your marketing materials, look at written intake forms, profiles you have on things like Psychology Today or other directories. And then we want you to think about whether you'd like to start disclosing your pronouns to people, right? And why do we do that? I'm sure you see it often. Some of you do it already naturally. It also sends an important message that you don't assume you know people's gender just based on looking at them, right? So if I don't disclose my pronouns to you, I'm kind of buying into a rhetoric that you should be able to know what my gender is and I shouldn't have to disclose. And so it's respectful and caring, even if you think it's not that important to you to convey it to others. So you can think about on your online medium profiles, including it. You can think about email signatures. Now, we also want to be thoughtful that it won't be the right choice for everyone, because the act of disclosing your pronouns is an act of coming out to some degree, right? Of sharing something about yourself. And you may be someone who is not comfortable sharing that publicly. And we sure have respect for that as well. But we want you to think about it and make that decision with that knowledge. Chloe, why don't you jump in and talk about the others or add anything you think I missed there?
Yeah, I will second that. We talk. We have a little bit of a whisper network in the trans community, and we have ideas of who may be affirming and who might not. But when we don't, those are some of the things that we do rely on, is taking a look. And I've seen, and I actually did this myself. At the beginning was like gender, and you may put 2 or 3, but the easiest way to other someone is by saying other and then having them list it, and even doing something different by saying unlisted could be another way to go. So it's not literally othering. And it was funny listening to Dr. Krumm talk, or Angela talk, about some of the CBT things there, because I'm like, oh, that was me. Okay. So I started to understand it a little bit better. And really, my calling card was black and white thinking for a long time. So that was helpful for me. The gender neutral language is really important, but also using clients' pronouns is really important too. And there were times when I switched back. I tried on that pronoun in therapy, the she, her, and it got really scary for me really quick. And I went back and I said, no, I don't think that's right, even though I knew for me that it was. So we may do that. And, we're hoping that you'll be able to kind of come along with us on that journey, but also understand that mistakes are going to happen. Everybody's human. These things happen. If you could have seen me back then, I was very, very far on the gender binary into male presenting, and mistakes were made. And the best way to work with having misgendered, oh, sorry, I meant, she, or, the proper name, and you move on from there. Because if you don't make it a big deal, we generally won't make it a big deal. What happens sometimes is it becomes so awkward that we end up kind of taking care of the other people in our lives. And this isn't just with therapists. I mean, I've had it happen at professional conferences and things along those lines. And the intent is good and the intent is understood, but it's a lot easier for everybody if you acknowledge the mistake and moving on from there. And one of the best things that happened to me was community. And that's continued to be important in my life and something I continuously search out. But when I was coming out, I was not ready to go find my own community. I didn't want to know that existed because I was exceptional, right? I was the only one who had the situation exactly like me, so nobody could possibly understand. I'm sure some of the CBT therapists could work with me on that in the past. But so what my therapist did was she let me know, like, hey, this exists. Hey, this is a safe coffee shop. This is another place that these are some things that are happening in the community. Do what you want with it, but you can know that they exist. And I could start to inch towards those. And inching towards it for me might be driving, sitting in the parking lot, and never getting out of my car. But that is a move towards it. Community is going to be really important for a lot of different reasons. So that kind of leads me to, is lived experience needed to be a good therapist? It depends, which is the answer to most things I have learned since therapy. Um, can it be helpful? Sure. Can it be limiting? Sure, because then you can start to view your clients through your own personal experience, having, a gender diverse experience or transitioning. And there is no one right way to transition. There are guidelines, but there's no one right way to do it. So it can be helpful, but as in my experience, it wasn't necessary. I think people can do a great job without it as well. And it comes back to, even if you don't have that experience, maybe you can connect us with somebody who does. And I will turn it back over to Angela.
Yeah, I'm excited to talk about this given my work as an ally and a cisgendered woman working with folks in the gender diverse and trans communities. I think one thing that's important to think about is that if you don't have lived experience, like I don't, if we all said, oh, then I can't work with folks who are gender diverse or trans, we simply would be denying treatment to a huge number of people because there simply aren't enough providers with lived experience for us to get off the hook that way, right? To back away from working with populations that we're not a part of. And so I would argue that it is our job to do our own work and to assess our readiness for how to be ready if we're not. And I have some ideas for you of how you can join folks who want to just keep learning and get better. I will say, to Chloe's experience, when you don't have lived experience, it's just that much more important to help people find community so that they do have mentors within the community as well. And that's true across populations you might be working with that you're not a part of. So how can we do our own work? I have a couple simple resources also listed in the resource list for you. One is a book called You and Your Gender Identity, A Guide to Discovery. This is by Dara Hoffman and actually was newer to me. I mean, there's so many good resources out there. One was introduced fairly newly to me. It's a book I love. Clients can use it. You can do it. You can use it to just really start by exploring your own gender identity and then understand how you can help others explore it as well. And then there's this interesting tool out by a person named Adam Saceda, which actually lets you self-assess your readiness and your view of gender, of working with gender diverse folks. And so you can actually just Google this right now if you're a multitasker. It's called Approaches to Working with Gender Diversity. Put in Adam's name. And what it essentially does is it lists these like stages of learning and development. And you can do this very quick just by reading them, self-assessment of where do you fall. And there's a couple initial ones called unaffirming or neutral. And I would challenge you that if you feel you fit into those, then you're probably not ready to take on folks who identify as trans or gender diverse, because I would worry that actually there could be harm done in those cases. And I'd encourage you to refer out. Right. Now, if you fall into the other categories, there's categories called novice, friendly, affirming, and then competent or specialist, right? And these are the ones that show just this increasing level of learning that you've come through and progress you've made in understanding gender and how to work with others in an affirming way. So those are some simple tools you can do, and then get support, find others who you can consult with and connect with. I'm going to move us through the intro of the standards of care kind of quickly so that we have time for our Q&A. So I might be a bit briefer here than I would otherwise prefer. So the World Professional Association for Transgender Health puts out something called the Standards of Care. They're currently on version 8, which means they've been around a while if we're up to version 8, right? I'm going to read to you just a brief quote about the purpose of it. I think it summarizes it quite well. The overall goal of the Standards of Care version 8 is to provide healthcare professionals with clinical guidance to assist trans and gender diverse folks in accessing safe and effective pathways to achieving lasting personal comfort with their gendered selves, with the aim of optimizing their overall physical health, psychological well-being, and self-fulfillment. And one thing I love about that quote is like it's talking about the idea that we want to focus on the whole health of the person. And the reason, as mental health professionals or the few medical professionals in the audience, that I'd want you to be familiar with it is because it really teaches you about the range of medical interventions available to folks and emphasizes what Chloe has said multiple times, which is that there's not one path to treatment or one aim for all folks, right? But it shows you options. And so, you know, as we've talked about, not everyone even wants to buy into the gender binary to pass, right? So it's not like everyone's trying to move through certain steps to get to a certain way of appearing in the world. It might not be their goal, or it might not be attainable or realistic for them, or it might not be within their resources to do it, right? So clients choose what they want, and this is the key, because in the history of the standards of care, if you have a client come into your office who's nervous about the standards of care, they may even bristle if it comes up. I don't usually name the standards of care for folks anyway, but it'd be fair if there's bristling and nervousness, because in the history of the standards of care, mental health professionals were given a very strong gatekeeper role. And actually, the history of that has kept a lot of mental health professionals away from working with gender diverse clients because they're nervous. They don't know how to feel about the gatekeeper role, or they don't like it, or it feels like power they didn't ask for, and they don't feel like they have enough expertise. So luckily, version 8 is really removing much of the gatekeeping and is talking about informed consent. So mental health professionals now have the goal of helping clients make their own decisions and respectfully trusting that the vast majority of humans should be making their own decisions, right? And that seems really wise. So we get to support them in that process. It used to be counseling was required even before hormone therapy could be granted by a medical professional. It's no longer required. There are still some medical clinics or doctors who will ask for a letter of support for certain surgical procedures. Almost always the request in that letter is, can you, as the mental health professional, confirm for us that this person is in a good place to make a decision, right? Are they ready to give informed consent? And so in that case, you might be ruling out like an acute psychosis that might prevent them from making a good long-term decision about their own body and healthcare, right? So it's really a beautiful shift that has happened that allows us as professionals to get back to what we do really well, which is not gatekeeping, but is supporting and helping people make decisions that are right for them. As you see on the slide here, there's chapters for specific populations and specific topics. It's a ton of detail, a lot of it for the medical specifics. And so you can flip through it, you can read the chapters that are appealing or interesting to you, and hopefully gain some knowledge from it. So before we turn to Q&A, I will highlight one resource here for you, and I think Chloe will probably highlight one of her favorites. But Chloe, did you want to add anything about the standards of care? Do you feel like I covered the basics
No,
there?
I think we're good, and I'm going to throw out a quick pitch. If you can stay around to the end of Q&A, I will give you the easiest thing you can possibly do to make anybody in your life have a better day.
Oh, that sounds like a really good story for you to tell us. So let's talk briefly about the resources and then we'll do it. So you'll see 2 slides of resources. You can download these handouts. One I'll highlight for you is that we at FGI, we've collaborated with a number of people in the larger Team CBT community over the past years with our diversity committee to develop a course that is helping CBT therapists be more effective in serving a broad range of diverse populations. We're running one right now, the next one available, you'd be attending in March and doing a bunch of asynchronous stuff before that. So I'll put a plug in for that if you're interested in learning more about these things. Chloe, did you want to talk about, there's one of these, I think you have a lot of cool stuff to say on.
On the next slide, I would ask that you check out the U.S. Trans Survey of 2022. It's really going to inform you about the realities of what our community is facing right now. And I'm sad to say that in a lot of places, it is getting worse. The biggest thing I took away from this was that over 80% of people said that when they started transitioning, their life got harder, and well over 90% said their life got better at the exact same time. So you can understand some of the work that you're doing there. And I just realized if you look up Erin in the Morn, if you Google that, ERIN in the MORN, she has a trans safety map. So you can have an idea of what the legislative picture right now is for trans people in your state.
Okay, so Jill, I think we should do Q&A.
Yeah, that sounds wonderful. So we have 10 minutes left, and so we'll do some Q&A, and we have a couple slides that we just want to sort of learn more slides as well at the end, and I don't want to miss Chloe's awesome comment she wants to throw in there too. So we'll try to do all of it. They're pretty sophisticated questions, so I guess we're going to try to answer them briefly. First, I'll just lead with a few very quick comments, not questions. So I heard from more than one person, please convey my gratitude to Chloe for sharing her story in order to help us be better clinicians. I also heard a lesson learned clearly, even someone without lived experience can be very helpful as a therapist. And that Angela's deep dive into how to gently examine distortions was really helpful as I was thinking about how to approach differentiating between distortions and an experience of discrimination. So thank you for the tips. And now questions. So a question was, and this is really a big one. I don't know, Chloe, if you can highlight one or two things, but the question was, did Chloe's therapist prepare and help her to transition? And what were some of the most important things that her therapist did to prepare her?
Yeah, so mine did, and she was familiar with my workplace, which for me was helpful, but a lot of the lessons are transferable. So, how to deal with surprise reactions, and people will surprise us in ways that are positive and ways that are not so positive. People that I thought would be very cool with it were not, and the others, that was absolutely true on the other end of the spectrum. My most conservative friends who I thought would struggle with it were fantastic and are still some of my best friends. Some of my college teammates are still some of my best friends. And then she also prepared me to help stand up for myself. I was not a confident person. A lot of us, when we first start transitioning, are over accommodating because we feel like we're imposing on other people by being ourselves. I've changed slightly over the past 8 years. I am not like that anymore, but I was at the beginning. So having lessons, reminders to be confident in who I am are important too.
Wonderful. Thank you. And another question that was asked that's sort of along the lines of what Angela presented with CBT, and Chloe, I don't know if you have a thought about this or Angela, but how did your therapist avoid making you feel like you were being victim blamed when making suggestions about setting up for success, right? Like how to turn that from being like, well, you did it wrong, to feeling
Yes.
actually supportive and empowering, right? Rather than blaming you.
I appreciate that question because that is exactly who I was. I would have said, well, you obviously don't get it. But the way that she was able to work around that with me was by acknowledging that it shouldn't be this way, that I shouldn't have to consider all of these other things. I shouldn't have to look over my shoulder. I shouldn't have to scan every room. It shouldn't be that way. And I hope that it isn't that way forever. But let's deal with the things that are in front of us right now, no matter how crappy they are. And her acknowledging that it shouldn't be this way, but it is, really helped me be able to move to that next step from grief to plans.
That's awesome. That's such a great succinct way to think about it. Someone or a couple of questions, and I don't know if you guys have this on hand, and if not, maybe we can follow up, but any favorite resources for parents struggling with their child's evolution of identity? I don't know, Angela, if you know of any, or Chloe, if you do.
I don't have them offhand, but I do have them in my resource folder, so I will send those out to you as well. One resource for parents as well is PFLAG, PFLAG, where you can find some community there. And then also, if you have an LGBT resource center in your county or city, you can reach out to them. And if you don't, you can also reach out to me. My website is chloe-corcoran.com. Be happy to try to help you out there too.
And we're getting a couple people chatting me that PFLAG. So, the letter P and then flag.org. Okay, awesome. And thank you. We'll continue to forward some resources to people in a follow-up email. Yeah, I got a bunch of people actually asking that same question. Oh, this is one. Is it common for transgender individuals to react with great anger if others accidentally use a wrong pronoun? And a therapist saying, how can I help clients overcome this anger?
I wouldn't say that it's common, but but it does happen. It's not so minuscule of a percentage of people that it happens for, that you wouldn't really have to prepare for it. So what I would tell you is that they're probably reacting to what they feel is an invalidation of their identity. And also, if they are trying to be a person who passes in a certain gender binary, maybe the reality that they might not at the moment. So it's coming from a place of pain and grief. And, first acknowledging it, something along the lines of, I see that this has made you feel really upset, and I can imagine there's a lot of reasons why. Can we talk about those? And then you can start to get into some of the deeper reasoning behind, what is really behind that? Because at this point, they probably already trust you as a provider. So it's probably misdirected anger from other people who are doing it purposely in their life, which unfortunately happens fairly often.
I would love what you're saying, and I would just add that in the approach we use here at Feeling Good Institute and Team CBT, we actually aren't in the business of telling people not to be angry or helping them overcome their anger at all unless they want to. Right? And what that means is we actually celebrate the beauty and the emotions. And Chloe was speaking to that to some degree, right? That the anger makes sense and is justified. And I think if you find yourself in a position of trying to like, oh, I want them to let go of that anger, I want them to let go, and they're not asking you for that, then you're not going to succeed anyway because you're working on a different agenda than the client. And so if someone wants to be less angry with being misgendered and ask you for help with that, then lots of ways you can help them with that through the mood log and different approaches. But we'd first have to see the beauty, the positive in that anger first, and honor how maybe self-protective that is, and how indicative it is of their orientation towards fairness.
Thank you. We'll do one more question, Angela. Maybe you can start this one off, but and then I do want to hear Chloe's last words, and then I have a few slides to cover at the end of a learn. But how can we respectfully assess to what I think this is very much what you're talking about with Team CBT, but how can we respectfully assess to what degree a client's psychological pain is coming from gender issues versus just typical psychological triggers? And is there a good source of history questions for these issues?
Wow, that's a great question, and I'm not sure I have a good answer for it.
What I was, Angela, just to get you started, or what I was thinking about was just, the same, in some ways, I think it's back to kind of like, we don't know what a patient is looking for help with. We don't know the source of their pain. And like, the way that we do CBT is very much trying to think about a specific moment in time where a patient was really struggling, and then trying to understand how they were feeling and what they were thinking, and basically learning from our patient sharing with us, what are the thoughts that are driving their feelings. And I think once we can get specific with our patients, we're not trying to sort of like throw methods at a feeling, right? We're trying to understand what caused that feeling, what they're telling themselves. I think if we stay specific instead of vague and general, then we really can learn from our patients what is causing their pain, right? Is it, another type of trigger, or is it, gender related?
Yeah, absolutely. It keeps us out of philosophizing or theorizing about it and into what they want. Thank you, Jill. I love your thoughts on that. Let's hear Chloe's final point that
jumping in here, just real quick, I do want to say about the pronouns too. If you put your pronouns out there first, it allows you to ask other people for their pronouns too. If you only ask the person you think may be gender diverse in the group for their pronouns, that can be othering as well. So what I will tell you is that I spent a lot of time being afraid when I first started coming out, and coffee shops were my haven. The very first thing I did when I entered any coffee shop was scan that room to make sure that I knew who everyone was, where they were, and how I felt that they perceived me. Here's the simplest thing you can do. If you see somebody who looks a little uncomfortable, any person, anywhere, in any coffee shop or building, smile at them. When somebody smiles at me, I know that they're safe, that they see me, and either they don't know or they don't care, or really it doesn't matter, but I know at least I have one safe person in that room, and you can change somebody's entire day with that.
Thank you so much, Chloe. And Angela, if you can show the next couple slides. We hope that you learned a lot today, and we love to offer these monthly, first Wednesday of the month, monthly free 1CE didactic webinars. And the next one is on November 6th. I can't believe it's already November, on getting unstuck, overcoming resistance in therapy. That'll be led by Richard Lamb. So we hope you'll join us for that. We also have a new workshop coming up that David Burns and I are going to be teaching together in collaboration and hosted, in hosting with Palo Alto University. And this is the first in-person / online workshop that we'll be doing together since pre-COVID, because we've moved all of our training to online exclusively. But this is going to be in person in Mountain View at a beautiful Palo Alto University space. And we're also going to be live streaming it online. And we're offering an early bird discount now, but the price will increase on October 15th. You can see the prices on the slide. So if you're interested in joining us for this workshop on dealing with thoughts like I'm not good enough and feeling not good enough, which both therapists and patients struggle with, and I think probably all human beings. So we hope you can join us for that workshop.
I think, Jill, the date is not on the slide unless I'm looking past that. So we'll have to follow up with the date unless you have it.
Yeah, you're right. It is December 6th.
Okay,
Friday,
great,
December 6th from 8:30 a.m. to 4:30 p.m. Pacific time. So more info on our website, and we'll send it out in a follow-up email as well. And if we can look at the next slide. In addition, we have kind of two other options. The one on the right, the core skills course, is an asynchronous home study course, and the fast track is kind of a hybrid where there's home study as well as practice groups. And we have a $50 off coupon code now that's called FAST50, and we'll send that out to you as well. But just kind of giving you a heads up, those are two other, really kind of high quality trainings we've been working on improving and perfecting over the last year. So we hope you can take advantage of continuing to learn and grow with us. And I'll go to the next slide, Angela. So you already know, we'll skip this slide, how to get your CE credit. I dropped the CE survey in the chat box. And so we'll move on to the final slide, which is just, I'll start first by just saying thank you to Angela and Chloe. This was really, I think, just an incredibly brilliant, but also moving and heartwarming and connecting presentation. I really enjoyed every minute of it. And I know that our attendees did as well. And then also a thank you to everybody for joining us, for caring about this topic, for wanting to learn and grow as a therapist. And we hope that you'll continue to keep attending our trainings and joining our community, and just all of us kind of aspiring to be better therapists and better people. And I think Angela's info is on this slide. If you want to get in touch with Angela, if you want to learn more about trainings, you can reach out to us as well at certification@feelinggoodinstitute.com. So thanks everybody, and a big, huge thank you to you, Chloe.
Thanks everyone. Thanks for coming. Have a great day.